How long can latent TB infection remains in the body? Have you ever wondered how long latent tuberculosis infection can stick around without causing any issues? Latent tuberculosis infection, often called LTBI, happens when Mycobacterium tuberculosis bacteria are in the body but are inactive. This means they do not cause any symptoms and the person isn't contagious. The fascinating part is that these bacteria can remain in this dormant state for an indefinite period. They can last for many years, or even a lifetime without leading to active disease. The length of time that latent tuberculosis can stay in the body really varies from person to person. It largely depends on how well the immune system can keep the bacteria under control. For most individuals with latent tuberculosis, the infection can remain dormant indefinitely. However, if the immune system weakens due to conditions like HIV infection, diabetes, cancer, or the use of certain medications, the dormant bacteria can wake up and lead to active tuberculosis disease. This reactivation can occur many years after the initial infection. It's crucial to understand the importance of treating latent tuberculosis infection. Proper treatment can significantly lower the risk of developing active tuberculosis disease later on. In fact, with the right treatment, about 90% of individuals with latent tuberculosis can prevent it from progressing to active tuberculosis. To sum it up, latent tuberculosis infection can linger in the body for decades or even a lifetime without causing symptoms. However, it does carry a lifelong risk of reactivation, especially if the immune system becomes compromised. Regular screening and preventive treatment are essential strategies to manage this risk and help reduce the overall burden of tuberculosis disease. If you think you may have been exposed to tuberculosis or have concerns, it is always best to consult a healthcare professional for personalized advice.